Good morning, everyone. Thank you for joining us on this cold, early morning. I would like to call our meeting to order of January the 14th, our called meeting. If I could have a motion to accept the agenda, please.
I'll make that motion.
Motion made by Ms. Robinson, seconded by Ms. Wimberly. Just want to let everyone know that we have 3 other board members that are, as you can see, one of them on the screen, I think, here. Yep, they're joining us virtually. Ms. Crosby is not feeling well, so she will not be joining us. So, and before we get started, I'd like to just talk a little bit about the fact that I know this called meetings are always kind of touchy, and people sometimes think that, for lack of a better word, that we have something up our sleeve, and that's the reason why we're doing it. But just want to let you know that Mr. Pye asked that he give us an update on the school situations with everything that's going on, and he met with several different groups yesterday to gather information. And the reason for the meeting beginning at 9 o'clock this morning was definitely not because we didn't want people here to comment or whatever. We always welcome your comments. So, and believe me, via email, text, phone calls, we all got lots of comments. So we have gotten your comments, and we welcome the ones that are here today. But the reason why we did it at 9 o'clock was basically it was an emergency, just as we said. The reason for the call meeting was an emergency to get an update on what was going on, to see if any action needed to be taken based on information that Mr. Pye had gathered. And if so, it would give us ample time, if we needed to take action, to give parents notice to do what needed to be done for their children. So we were, believe it or not, we were actually thinking about the parents and about the situation that we could possibly put you in if things went maybe a way that was going to impact your family. So that being said, we are going to move on the agenda to public comments on agenda items. The first one that I have up is Irene Cronin.
Shall I start? Okay. Yeah. Thank you. I am not here to give you any grief about any possible virtual, if it's due to DHEC and lack of staffing that is beyond your control. So I want you to know that first and foremost. But I also need you to be very vocal to DHEC to let them know that these guidelines are no longer scientific or applicable, and it is disrupting students' lives and their education, and that ripples throughout the rest of their lives. So I just want to say that. And I have nothing bad to say about the teachers. They're trying so hard as they can, so I appreciate everything that they're doing. But let's talk about the difference between Omicron, Delta, and COVID. Omicron, per the CDC director, we're looking at it being 74% less risk of ICU admission than Delta, which was lower than original COVID, 91% less risk of death than Delta, which was even lower than the original COVID, and 53% less risk of symptomatic hospitalization than Delta. Some other statements that they've made. What they, meaning the vaccines, can't do anymore is prevent transmission. That's CDC Director Rochelle Walensky. We don't have vaccines that block transmissions. We have vaccines that help you with your health, but they only slightly reduce transmission. That's Bill Gates from the Gates Foundation. The level of virus in the nasopharynx of a person who's infected and vaccinated is the same level of virus in the nasopharynx of a person who is infected and unvaccinated. There is no difference in the amount. And that comes directly from Anthony Fauci. And so far as the masking, I don't know if that's a consideration going forward. But with Omicron, it's an aerosolized virus. Cloth masks are absolutely useless. And the surgical masks, even the 3-ply, are only marginally effective. If you're looking at masking, then it's people who have severe comorbidities or who want to avoid infection need to be wearing a properly fitted N95. and enclosed eyewear, because the virus stays suspended in the air for hours and it also enters through your eyes. Masking the entire school is worthless. It's useless, and it's actually doing more harm than good. So if you have a health issue, N95 properly fitted and enclosed eyewear to prevent transmission into the eyes. Everyone else needs to go back to regular life. This is the same as a cold for children and the flu for adults. That's what the data and statistics show. That's directly from the CDC. Thank you.
Thank you, Ms. Cronin. Okay, next up is Jay Mace.
Morning, everyone.
Good morning.
My understanding is I'm a 36-year veteran of the Air Force, retired, and my understanding here is that all of these schools here that we're having an emergency meeting when there are many parents that are not able to be here because of the fact that they're working. So to have a meeting this early on a Friday is very hard for parents. So I hope that you take that under consideration the next time you decide to have a meeting. And I wanted to understand that I hope that we're not thinking about going back to virtual schools because of so many people that are on this list that have the COVID virus, because this brings too much upon the parents to have to get their children taken care of because of the fact that they can't go to work or they take vacations and all of this right here. And this we're already 2 or 3 years behind. If we continue in this manner right here, we are going to continually fall behind the rest of the country and the rest of the nation. So we need to take all these things under consideration. They're pouring millions and millions of dollars for the salaries of teachers. And then you're having the parents to have to teach the children. It's just too much involved in order to have parents to have to do that. So if you need to get more subs, you need to go ahead and get the subs. But don't mess around and shut down the school system, because we're just starting here in 22. And we do not need to shut down anymore because our kids are behind and our parents are not able to spend the time that is necessary for the kids to get the education that they need to get. So I'm very brief. That's all I got to say. God bless.
Thank you. Next up is Mark Perel. Did I say that right? Perez, okay.
Good morning, everyone.
Morning.
I want to thank you for speaking a lot of truth in the beginning there, so you're going to make me very short for this. You've said a lot of things I was thinking about saying anyway. I have a student in the middle school, currently in 8th grade, and I know many of you or others that are at home have students that have already been falling behind more and more. I mean, this has affected three basic years of these children's lives in education, and there's many studies already showing this is going to be irreparable damage and may take decades to recover for many of these children. I understand a lot of the things that I was a former school teacher, so I understand a lot of the people that are working in the educational field, your struggles right now. You're basically dealing with a lot of top-down things, being told you have to do these things. One thing that I wanted to address is I hope we don't go back to virtual. I hope that's not even consideration. But for example, my student was listed, I got Tuesday, that he was in close contact with somebody that tested positive for COVID. So he's basically sitting at home for 5 days now, not being able to do anything other than go on his computer and maybe look at what the teachers list for homework. So again, he's missing more time. And I find it somewhat discriminatory because he's not vaccinated. It lists detailed on there. He has no symptoms, nothing. But he has to stay home. But somebody that's, quote, vaccinated, that as she had mentioned, it does not make any difference between the person that's going to be able to be vaccinated or not be able to spread it, to receive it or anything. He has to stay home for 5 days, and many other people are probably dealing with this too. Luckily, I work from home, so I can take care of him and deal with these things. but a lot of other parents have to take these times off, and it's affecting so many different parts of our lives. I just hope that you consider and look at the best interests of the children, because I think that's the most important thing we need to look at. Thank you for your time.
Thank you, Mr. Perez. Okay, that's all of the public comments. So we're going to turn it over then to Mr. Pye to do our update on the COVID conditions.
Thank you, Ms. Hughes, and I appreciate you giving a brief explanation of the meeting, and I am the one that called her and told her I felt from Monday night things were changing radically. I mean radically, like in 24 hours, numbers were doubling, and we really have an issue here because the main problem is the operation of the schools. We're not able to do other things to keep children safe, let alone teach them, and as our teachers are paid to do, they can't do it because they're doing too many other things, and they're teaching 2 and 3 different ways. It's really becoming a hardship on everybody who wants and is used to excellence in the school districts, but also we know that if children aren't safe, they can't learn. So we've got all these issues, and I've received so many emails on all sides of the equation. And we've gotten a lot of wonderful information, and I don't doubt any of that information because I read a lot of the stuff too. The situation is we still have a State Department of Education that is controlled by the state legislature, that's controlled by government, and it trickles down. Unlike the parent had suggested, this problem is definitely not unique to our district. It's a national problem. There's some schools that haven't been open in 3 years, period. And I mean, it's worse than other places. But we've done everything we can, and everything we propose or bring to you, it's all about keeping children in school because we can't teach them if they're not here. But I'm also concerned about the safety of the children, but I'm very concerned about the safety of our staff. Our staff, many of them have underlying conditions. They have others that have elderly parents living in their home that they're real worried about, and they're concerned. And of course, when their daycare closes, lots of our teachers with young children, they have to stay home with their child too, so they're not able to provide services to our children. So on some days, like today and yesterday, the numbers are, as they're calling in sick and they're staying in and they're on quarantine and all the various reasons they're home, is the numbers are astronomical. The people that support us in the schools, the secretaries, the guidance counselors, the nurses, they're on overload. We're using them to fill in for the classroom. They're not trained instructors, but they're there because we have to provide a safe environment for the children who do show up. If 2 children are in the classroom, there has to be someone monitoring those children. Some of the schools, because of the numbers and of having enough supervision, have had to put 3 and 4 classes in, like a library, a lunchroom, or and that definitely takes already a bad situation, particularly the high schools in the middle, where we've never been able to social distance properly, and then now no social distance, whether you believe in masks or not, you have neither one. So it's there. No matter how you feel about it, it's very contagious, and our children and our staff have no choice. It's just the way it is, and we're putting them in, I feel, in harm's way. I've spent time yesterday talking with staff, with superintendents for the last all week long. We did a lot of preparing the week before for the board meeting Monday night and felt comfortable with the presentation, and we had nothing ready to report to you that we felt we were in a danger zone. But the numbers are getting so high that we do have to do something, maybe if nothing else, just a few places. But I'm not here today to advocate a mask mandate. I'm not here to advocate virtual school. I'm not pushing any of those things. I'm telling you what few choices we have, and you can choose whatever that might be. I'll have a recommendation, and then if you decide you would rather do more or less, that's your opinion. But we can continue doing what we're doing now. It's just I feel responsible to report to the board and the public the astronomical numbers that are doubling each night, and so before our eyes. And I think that's critical enough that we cannot hide that from the public, and I think people need to know what they're dealing with, good, bad, or indifferent. With that said, I've asked Amanda, our nurse, head of the nurses, to start us off with just what's happening with these numbers since Monday night.
Thank you, Mr. Pye, Chairwoman Hughes, members of the board. Give me 1 second. So as Mr. Pye mentioned, we're in a fast-changing, evolving situation here when it comes to the current numbers. This is the current, as of yesterday, county-level disease activity metrics. We reported out on this on Monday night from last week's metrics, and as you can see at the bottom, we've seen an incredible increase in our community-based transmission, our incidence rate, as well as our percent positive just since last week's report. If you look back to the top of the chart, back when we were in October and November, we were seeing a steady decrease in our numbers and we were trending down. We were feeling better about things. We were able to reduce some of our mitigation strategies in the school, maintaining safety, but also getting back to some of the things that we consider to be for typical school. We have seen a steady increase over the last few weeks, and as you can see, the most recent numbers are there at the bottom, and they're quite high. So the issue is when we see such high-level community spread, unfortunately, that has an impact on our schools. It impacts our students because it impacts their families and their households, individuals they're in contact with outside of school. So it's troubling when we see numbers increasing at this rapid level because we see that the spread is moving that quickly in our community and therefore impacting our schools.
Hold for just a minute, Amanda.
Yes.
Lee, is there any way we can zoom in on these numbers? Because I can barely see them. I'm sitting very close. I'm sure the people in the back of the room are having a very difficult time reading any numbers at all. So I'm wondering, can we zoom in like the bottom part of that, or is that stationary? That's stationary for what it is. Like you do on your telephone, you know, want to make, technology's not my thing, but there's got to be a way to make it larger.
Is that a little bit better?
Yeah, that's better. Can y'all see it any better? Yeah. She was referring to, just to go back quickly since I interrupt you, the arrows are going up ever since back yonder in November. And you saw up there like on November the 24th, just look at that, it's 164. Then it went to 150, 164, then it went to 151. That was the low point. Then look at it, December the 8th, 221, the 15th, 301, the 22nd, 368, the 29th, 795, January 5th, 1156, and that's what we probably had from Monday night's meeting. And since now this Thursday, this is what's come out, 2367. That's more than doubled in 1 week. So you see the escalation. That's community numbers, and that we don't. That's not our numbers. That's what we get from DHEC and the state level numbers. And they do this for every county, and they have a map showing which districts are high, medium, and low, and everybody's highest. It's just we look to see who's higher than us or whatever. And there's some districts, believe it or not, are double what we have. Okay, so that was that. I'm sorry to interrupt you.
Okay. So just getting back to the metrics briefly, just so that they're a little easier to understand, that first category where we're above 2,000 at this point is our incidence rate. So that's the number of new cases for the period of time reported. And then that third category is our percent positive. So of the total number of individuals in our area being tested, that's the percentage that are testing positive. So we are in communication with DHEC, and they're reporting that they're seeing the highest case numbers that they've seen in some time. I think they reported 14,000 new cases yesterday. So again, this just paints a picture of what we're seeing in our community and how it could potentially impact our schools, since our students obviously live and our staff members live in our community and their families work here. So this is our district dashboard. As you know, we reported out on this on Monday evening. We update this daily. We just are showing yesterday's dashboard to kind of paint a picture of the steady increase that we are seeing and the rapid increase that we are seeing. I would consider this to be an extremely fragile situation at this point with the number of cases that we are seeing. There are an increased number of both students testing positive as well as needing to quarantine per DHEC rules, but the starkest contrast to the last several months is our staff member numbers. We unfortunately are seeing high case numbers in our staff as well as high quarantine numbers in our staff due to the recent change in regulations. So when we speak to the operational status of our schools, this has a great impact because, as Mr. Pai said, regardless of how many students are there, it's very difficult and challenging to run a school when you're missing key people and teachers and other individuals.
Those numbers reflect only the things that's turned in that are COVID-related, perhaps. There are a lot of other absences in our district for various personal reasons, other sickness, doctor's appointments, you name it. There are other things that take our staff members out, and we have those numbers that we factor back into these numbers to get the total numbers. So when you look at infecteds, quarantine, and other issues of being out, some of our schools are very impacted, and the numbers are high.
So we had shown this slide on Monday when we were talking about what our plan would be moving forward and how we would attempt to slow the spread in our schools, keep our students and staff safe, but also keep our schools running as safely as we possibly can for in-person learning. We discussed classroom closures and what those metrics looked like, and we have been in a position throughout this school year where we have had to close classrooms due to case numbers and student quarantines. These are the metrics here that DHEC has provided for potential closure of a grade level or a school. And as you can see, there's a few options such as unable to maintain operations with current staffing, as well as some thresholds for both positive cases as well as positive cases plus quarantines. We're at a point now where we feel that we need to consider moving more towards the model of evaluating our case numbers and potentially expanding on the closures of classrooms, because we are seeing that we have reached these thresholds and gone above and beyond them in some grade levels as well as in a school. And so it's, again, as Mr. Pai said, our intention is never to take students out of face-to-face learning, but we are seeing at this point such a high level of school-based transmission between our students and staff members that we have reached a point where we feel that that is necessary. I will turn it back over to Mr. Pai at this point, unless there are questions for me as we move forward. Thank you.
All right, thank you, Amanda. And I won't be needing any slides or anything. I find them difficult to read, so I believe that's the end of the slideshow, unless we need to go back and reference something. I think I can just briefly summarize what I need to say. So you heard the alarming numbers, and take it from me, they are alarming. They're going higher and higher. We're getting now, our calls are coming rapidly every day by just about every school is reporting in the issues they're dealing with. So at this time, because of that, I do want you to hear from, not me, I'm way up here. You need to hear with someone who's in there, and our teachers are teaching so they can't be here, or they're the ones that need to tell the story from their viewpoint of what they're feeling, what they're seeing. However, I've asked 3 principals, an elementary, a middle, and a high school principal, just took a few seconds to share with you operational situations, things they're being faced with in their school. A little bit about the climate of the school. All right? And I've asked them not to be negative. This is not intended to be negative. I told them to be honest and tell it like it is. They certainly tell me. I don't want to hear one story and the public hears another. I think it's very important for us to all take in what we're hearing and factor it into our thought processes. So you're first. Miss Cubbage, she's principal of Newington Elementary.
Good morning, Mr. Pai, Madam Chair, and distinguished board. I'm Rachel Cubbage, the principal at the best elementary school in our country, Newington Elementary. I know these past 2 years have been trying for all of us, and I thank you all for your commitment to our community through it all. I know it has not been easy on you guys either. As I was trying to frame my words to you today and give a snapshot of how school looks right now, I put on each of my hats. I'm a mom of 2 in a home where both parents work. I'm a former single mom, a principal, an educator, and a community member. I get the privilege to work alongside amazing parents every day that are just trying to make ends meet and do the best they can for their kids. I see the absolute best educators in the world pushing themselves every day to do whatever they can for our kids. The elementary principal team is a close group. We talk daily about how we are handling this or that and what strategies, looking for any inkling of a silver bullet to make this situation more manageable. As I tried to look at this from each of those perspectives to make sure I had considered each point of view and was going to be standing in front of you with the words that I knew to be true based on all of these pieces and a deep understanding of the logistics and intricacies of what makes the school work, it all came down to this. Every year, my young students and I have a talk about what it means to be a principal. What is my job? And I explained to them that I have 3 jobs: to keep everyone safe, to take care of my kids, and to take care of my staff. Now, we all know as adults that there's a lot of labels that go underneath those 3 things, but for my 5 and 6-year-olds, that works. And I can't do it alone. It takes an entire team. It has a lot of people that has to put all of those things together to make those things happen. One fact that I just want to remind everyone, and I know you guys are aware of this because you've said it to our community before, but we are governed by other bodies too. The federal government regulates Title I money, OSHA regulates our safety measures, FDA regulates what needs to be served, and DHEC regulates the health requirements of our students and staff. DHEC determines specific criteria for shot records, exclusions such as you can't attend school with a fever or throwing up, and they've also determined the COVID exclusions. I know many of us would like to throw out quarantines and isolations out the window to return to school as normal and to not have to deal with any of that anymore, but as a public school building, that's not an option right now. I was asked to share the current conditions in our building while we work to try and provide the best education possible, our world-class education that we have all committed to bringing our kids every day, while also trying to follow the rules that have been laid out for us. As we all know, DD2 has been underfunded for over a decade, but despite that, we have had successful recruiting efforts to obtain the best educators for our kids because of the work environment and the relationships we build. Every morning, I have staff coming to me and saying things such as, what can I do? How can I help? Would it help if I took so-and-so's class with mine? We can go in the media center. I'll teach their class, my class, and my online kids. Our teachers are not trying to get out of working. They are doing the best that they absolutely can. But because everyone is wearing so many hats, everyone is wearing thin. And they're also falling to be more susceptible to illness because when you stretch yourself that thin, your immune system also gets more worn down as a part of that too. We truly do have the best teams at our schools, and I know my colleagues would say the same. At Newington, we have 715 students, and 70% of them live below the poverty line. Yesterday, we have 60 certified staff and 23 classified staff. Yesterday, 19 of our staff were out. That's 23% of my people. Again, today, I have 23% of my staff out as well. Earlier this week, I had an entire team that was out. When you have that many people out, staffing becomes a chess game. I sit each evening looking over my list of who is out and their return dates, making sure to include the others that are out for just typical stuff, texting those that have been ill to see if their symptoms have abated enough for them to be able to work or if they'll need to be out, stay out longer. On the left side of the paper are the names of those that are out, and on the right side are those that I can pull to cover, and I just start matching them up. But when you get to 17, 18, 19 staff out, and every leadership team member is covering a classroom, from an assistant principal to a guidance counselor to my title facilitator, my math coach, my BIR person, my adult supports whose student might be out, they're all covering a different classroom. That leaves one administrator left to cover the building. So then what happens when one of my kiddos goes into crisis and starts throwing things in the classroom? The teacher buzzes for help. Who can respond to that call? When one of my kids that needs small group instruction and academic support shuts down because they can't get that, because that person is also covering a classroom, instruction stops everywhere. I can tell you that safety is jeopardized because we don't have enough adults to respond to the calls for assistance, or when the child starts shutting down because they can't get the small group help. And I can tell you that educators start thinking, I can't keep doing this. When you hire high quality people, they have high standards for themselves, and that's what we have in our teachers at our schools. And when they feel like they aren't doing their best because of all of these factors, that's when they start to shut down too. As teachers begin their instruction, the intercom buzzes, the teacher has to stop everything. 5 minutes later, the nurse is at the door asking for more students to be sent home. Then another knock comes to the door. I'm sorry, Miss So-and-so, your daycare just called. It's been shut down. I need you to go home and pick up your child. Materials have to be gathered and sent home. The discussion on fractions, no one remembers where they were at that point. My nurse, he is amazing. The pressure he is under, the amount of hours he is working, there isn't enough money in the world to compensate for the job he is doing right now. School hasn't stopped, so students are still coming with cuts and scrapes from the playground, medication needs, blood sugar testing, feeding tube procedures, throwing up, nosebleeds, the list goes on. He's balancing student needs that occur on a daily basis with contact tracing, answering questions to parents, trying to keep up with vaccination status, explaining to teachers and parents when students are able to return and if they have any stipulations. And he's doing this on his own because my UAP is out too. The DHEC guidelines are tricky, and the more if-then scenarios that are added to the rules, the longer it takes to sort through for each of these cases with each family. Add to that the frustration and the time parents are having to spend in line to get tested and then to wait for the results. This is what school looks like right now on a daily basis in elementary. Even with the best educators in the world and people giving every ounce of themselves, our children's education is not what it needs to be due to the circumstances that we're currently working in.
Thank you, Ms. Clubbage. I appreciate you. Who's next? Okay, Mr. Manser, principal of Jack Manser of River Oaks Middle School.
Good. I gotta stand close. Good morning. I didn't want to follow that. She kind of outlined everything, but at the middle school level, I reached out to all my middle school principals last night and said, you know, paint a picture of what's going on in your school, because I don't want it just to represent River Oaks. I'm one school of 5 other middle schools, and the answers I got back were all the same things that I'm dealing with. The picture that I have right now at River Oaks Middle School is I currently have 217 students of 927 at home, which is 23.4%. 17 of my teachers are at home, which is 27% of my teachers. We're doing everything that we possibly can. And at the beginning of this year at River Oaks, we said we can, we will, we must. We're gonna make it happen. My teachers do that every single day. They jump in, they ask, where can I cover? What can I do? How can I help? But at the end of the day, it's not sustainable. We can't keep doing this every day for now until we don't know when. The numbers come in, the numbers come in, the numbers come in. I'm thinking I'm gonna get this big group of students back, and then I get another group of students that's gotta go out. It's a daily balance. Safety is the #1 priority. We can't adequately deal with all the situations that go on when 3 of my administrators are covering classes, the instructional coach is in there, the guidance counselors are covering classes. We're using all hands on deck. My teachers are doing both of their planning periods and not taking a break because they have lunch with their students, because they want to give that to the school and they know that there's people in need that have to be at home right now. It's a constant balance. And I've always said that instruction drives the school, but right now it's coverage and it's reaching the kids that are at home while both in the classrooms. We're willing, they're willing, it's just not sustainable. Dual modality, when our students are at home, they're balancing that. When we're covering classes, it's very difficult. I get a lot of emails from parents, this teacher doesn't have a meeting today, that teacher's at home, so they can't schedule that meeting. And when I'm putting a different teacher in there every other period, they can't set up those meetings. So we're losing kids that way also. But at the end of the day, all my staff, the office, the custodial staff, the cafeteria, my nurse, Miss Santa Maria, we all are working together to try to make this happen, but I just don't know how long we can continue to do it. My teachers are getting tired. My students are tired. They don't know what to expect on a daily basis. We want what's best, and we're going to do whatever we can, and every school is willing to do that. I heard that from every single administrator that I talked to last night. We just don't know how long we can do it. Thank you.
And Mr. Manser, how is River Oaks helping your school nurse? Because the nurses are the most overwhelmed and they're working ungodly hours, and I know a little something going on at River Oaks that everybody else needs to know.
I was contact tracing till 2 in the morning last night to help my
He
nurse.
does the contract tracing at his school, administrator, to 2 o'clock in the morning. That's what's happening in the schools. So how fresh is he to be able to do his job on a daily basis. This is what's happening when you have the responsibility to keep your students and your teachers and the public expects you to keep their children safe. That's an awesome responsibility, and I did hear that last night, and I certainly appreciate you setting a great example to all that the work never ends.
Thank you.
Thank you for being so, and this is one hardworking man. It's all of them are, but a lot.
Good morning. I don't know how much longer I can hold it up. I just want to echo what everybody said about our teachers. We got to take time to understand that at Somerville High School, Fort Dorchester, and at Ashley Ridge, our teachers are doing well above and beyond. Their plate was full before the pandemic, and it is overflowing. But have they stopped? No. But as we've heard this morning, I'm concerned. I'm concerned that we're running them at full speed, nonstop. This morning we have 36 sections at Fort Dorchester, 40 sections at Somerville High School. I'm not quite sure at Ashley Ridge that are uncovered. That means teachers that are teaching their full load had to step in because subs, when the pandemic started, we have not recovered. We have 13 uncovered teachers, which means 3 teachers for every teacher who doesn't have coverage. That's not counting our front office. Our maintenance, both of our maintenance people are out. I have a security person out. We have lunch people out. So as administrators and teachers, we have teachers covering aides, aides covering teachers. But my staff is phenomenal, but they're running nonstop, 100%. How long can we do that before we start losing quality people? None of us want to stop. We know that's not what's good for kids. But at the same time, we have to be realistic. When I don't have maintenance, when I don't have security, when I don't have nurses, I go in the nurse's office every day and thank them and count and make sure they're still there and pray that they come back the next day because it is a non-stop. For the first time since this pandemic in the last couple of weeks, I've had to open up 2 rooms for sick kids to be isolated. And it's growing. But, for us, we're going to continue to do what Dorchester District 2 has always done, which is lead the way and work as hard as we can. But at the same time, the numbers and the workload is getting to a point where we're starting to get a little worried. You have any questions for me, Mr. Pike?
Yes, sir. I appreciate all of y'all, and please go back and tell your faculties and the other principals that we appreciate all of you doing this extra, and that's what makes us special as a district. We are Team Dorchester. We do hang together. The problem is I am a worrywart of the highest caliber, and with these exceptional administrators who rarely bother me with anything, they just do their business, and they keep it to themselves. They solve their problems, but now they're coming. How can you help us, Mr. Powell? We have got to do something. We are desperately sinking. That's where we were last night. It was just really a bad situation. Morale is all-time low, and we know how that affects people, that keeps them from being their best, and many issues. So, but I appreciate you articulating that, and again, we did not mean to be negative. We just want to be honest. Some of you have heard it from individual teachers, and you might question, are they being drama queens or kings? I mean, are they overstating it? The principals are here to tell you it's widespread, and the doers are really having a hard time for the first time. We're hearing from them that, we'll do anything for you. We've never complained, but it's getting overwhelming. And of course, the people who normally have a lower threshold of pain have really voiced their concern to the point of quitting their jobs and things like this. And we just can't have that kind of attitude. Not now. I need all the troops. I don't need anybody throwing their weapon down and leaving. We need them all on the front line.
And I could add too. I mean, it's like our bodies, our teachers, they're covering classes. But when I put a Spanish teacher in an AP calculus class, yes, kids are here, kids are seeing some instruction, but that's not the instruction that we want. We are making it, and we're going to make it. But we got to remember that when we start, especially at the high school level, when you start moving specified, certified teachers that are highly skilled at their content, and you try to put a body in there, that's not instruction that we're wanting. That's not getting us where we need to get. And so when you're putting English teachers in math classes and math teachers in English classes, there's a loss there. So But like I said, my folks, they're great, outstanding. They don't fuss. Not one time have I had to go to somebody and ask somebody to cover a class. They're team players, but they're running out of energy. And we're only halfway through the school year, but they're giving everything they got for these kids in this community. But at the same time, you know, it's getting pretty serious in schools. Thank you.
Thank you very much. To wrap that basically, as I told you, we've been dealing with DHEC, constant basis. I've been dealing with the State Department of Education. I was not able to talk with Molly Spearman the last 2 days, but I've talked to her deputy superintendent at length, and I've talked to her, I guess, administrative assistant, the young man that sends us all the information. We talked to him. I talked to him last night. I talked to all 10 different superintendents in the local area as we're monitoring other districts outside of the low country, like Greenville and other places. We're monitoring all those things to see if we're out of line or we're in line, and we're probably somewhere in the middle. There are a lot of very conservative districts who have closed. There are also other districts who are weathering the storm, and as far as I know, I don't see it where they made any changes at all, and obviously that's working for them at this time. Again, I'm not sure what their numbers are, if they're heavier or less than ours. But based on our numbers, we have to do something. And I looked at all the options from these sources of people. The State Department represents the wishes of the legislative group, this legislative assembly, and their whole point is rightfully so, let's keep the kids in school, let's keep learning going best we can. Let's take things on an individual basis and deal with it there and not close whole entire systems down to do. That's what we found out just about everywhere we called and talked and checked on. Of course, everybody's watching for that threshold, that when is it just finally time to throw the towel in, but it's going to be a last resort. You heard the comments from the folks that talked about the various things that they're opposed to. Well, lots of people are opposed to it. We want to keep children safe, but we don't also want to create such a ruckus that we're unable to have a school system that's effectively engaging the parents, the community, and the students and trying to get the learning at the optimum level. So with all those different things, we really have just a few choices before us. We can close the entire school district. The numbers warrant that probably would be justifiable. We can just plain ignore it and continue to move on. Or we can do a mask mandate and wear the masks and see if that mitigation might cut back. These are things that's before me. But there's one other option that I think is the best one and the only one we can do, and that's continue working with individual students, work with grade levels, teams, and then individual schools. So if one school is really out of line, that's the school we work with and not close the whole district or impose something on all children. Now, that's not a political compromise, but if you look at it, that's about as best you could get out of what we have. Among the choices that I put out there, I don't have any other choice. Ignoring it, we cannot do, y'all. That is irresponsible to just ignore it. To go hog wild and shut everything down and do the mask mandates and all those things could be knee-jerking if we're hearing the statistics and we believe half of them to be true, which I'm sure they are. Does it justify that? So it's a real hard thing, and all of us are all over the place, but I'm the one that has to listen to all of it and bring it to you. The reason for the emergency meeting is we've never made it clear for Monday night about what my powers as a superintendent is as far as in an emergency like Monday's weather. This is an emergency, and I don't want to call a meeting every time we have to shut down one school. It's not necessary, I think, to have a public meeting. I will notify you, but we will do that, and you can see that we're systematically doing it, and I would give you all the information that would warrant such a thing. And particularly right now, we have, it appears at this moment, the numbers changed. Last night we had none. So this was going to be an interesting meeting. I was just getting prepared for the future. But we have one that's definitely identified that we do need to close. And we're going to, and we got the long weekend, so that gives us that extra holiday, and probably close for 4 days, and then we have, we have the next weekend. So the way it's falling, it might be 4 or 5 days versus 10 if we maintain the other piece that we're doing. So I just wanted to throw that out, so you got to capture what you can, and so that's why we were eager to have this. We didn't feel we could sit on this to Monday, or no, definitely 2 Mondays to the next board meeting. So that's why the emergency. It wasn't, we're panicking, and didn't mean to send that out there, but it is an emergency. And for the people in that one school, it's one. And before the day is out, the way the numbers changed last night, I would be surprised if it's a second school before the night's over. And we're looking at 4 or 5 grade levels throughout the system. And that would have to be mainly elementary. It could be a middle school, 6th grade or something in a particular school. The teacher numbers are so high, and the students that we find that is not a healthy situation. But it would be by grade, and we put the highest threshold in place. And talking to some of our neighboring counties, we've been given some leeway of what it should be, and we're following the DHEC one. But there's some school districts, and they allow you to make it even tighter. And if we made it tighter, we might have a half a dozen schools closing. So I want people to understand, unless you direct me otherwise, we're trying to be as sensible, as reasonable, and methodical as possible with a plan that we know when this happens, this is what you do. Just like, you have a toothache, you go to the dentist, and he gives you several choices. We're going to pull the tooth out, or we're going to cap it, or we're going to fill it, or whatever, and that is up to you. Of course, if I'm in pain, take the thing out now, and we'll worry about how I chew later. But those are the kinds of things that we're faced with, and different people have different thresholds when they present to me. I, at one time, don't mind telling folks, I took it as negative, and I've had a conversation with some principals. I don't need to hear negativity. I already know you have a problem, and I don't want to look like I don't appreciate it, but I need you to bring me a solution. We've got to work as a team to capture this. I didn't create the pandemic. I can't make it go away, and I don't want to play God. And I'm a person that do this. I have to pull everything together and do what I think is the fairest, best thing. And so that's what I think, is that if you would give me permission to use emergency situations as they arise, and of course if it means closing the district, I would never do that without having a board meeting. I think that deserves a lot of discussion. So that's kind of where I'm at. But don't be surprised, that could be next week if these numbers don't stop. I mean, it's an issue.
Okay, does anybody have any comments or questions for Mr. Pye, Ms. Dwayson? Ms. Wimberly?
Is there a specific threshold? I know you mentioned your
The one that she mentioned, the 30%.
30%. So is that total students plus staff?
That's students
obviously, 'cause
plus staff, but you could do just students at 1 to 5%. You could pick either one of those metrics would be fine. But in our case, I am worried about the students, don't get me wrong, but the number of teachers are the problem. They can't teach virtually. They can't teach anybody if they're not able to teach. That's my concern. It's always been my concern.
Right, yes, that makes sense. So it's really two separate issues, it sounds
I'm planning
like,
to go out to a school to
safety.
help. I think I'm a very good teacher. I wasn't when I taught in this school back in the 70s. So you can imagine it's changed. I'm not good at technology. So we're doing virtual and we're doing dual modality. What good am I going to be in the classroom? And that's how a lot of our secretaries and teaching assistants, they don't have any kind of training. And then it becomes babysitting. And that is not what any parent wants. That's not any of us want. That's not education. So I'm going to be helping, but we decided today, the attorney and I are going as a team. We're going to do it. And we're going to do a kindergarten, and I can tear it up in kindergarten. But the students that are online with us, she's very technology savvy. She's going to be the teaching assistant, and together we'll get it done. They're going to learn.
Well, I'd like to just say this plan that you have come up with along with your principals, it seems logical, and it's following DHEC. And it's the law. It's not, it's been mandated, so it's not like we can wiggle out of that. But I have to also say I'm relieved because we don't need to pull everybody out. Just, sometimes you go, well, it's not fair to do one school and not everything, but it's really, that is fair. And so I think you're being as fair as you can under the horrible circumstances we're under. I feel that this is brief and it will go away soon. And I like your idea of using the holiday, unfortunately, but the holiday, then it's one less day that they're actually missing
At
in
least for the
school.
staff, if they have the 5-day, they're following that, and doing what they need to do, then that could make a difference for a large number that went out up through Wednesday. They would all be back.
Right.
So we do think that would help.
Did you say how many days? I think I missed that. Like specifically what?
Right now, we're using the 10-day rule for students.
No,
but
I
the
mean, how many
teachers is
days if you have to shut down or go virtual at a specific school, how many days would
4,
that be?
not more than 5, depending on, when I go with Amanda, I think she's going to say you got to do the 10 days. And so the 10 days would then mean Monday after the next Monday.
10-day total, that would include any weekends or holidays.
That's a holiday and 4 weekend days. That's 5 of the days. So half of it would be non-school days.
Well, can I ask to go on to the 5 to 10 days? The CDC has given us a choice, 5 days or 10 days.
That's correct.
And would you consider, because it has come through emails and phone calls that the healthy kids are really in quarantine for 10 days, where a lot of the children who test positive, they can come back much sooner. And so you have these healthy children, because they were in contact, having to stay out for 10 days.
I've asked the same question. I have pressured people beyond the call. This is what we have to do. It's logical. It seems to make sense. But, Amanda, would you address that like you addressed me repeatedly? Because I've been trying.
So as you mentioned, we are getting this comment a lot, and we certainly do understand where parents are coming from. Their frustration is they want their students in school, and when the timeframes don't quite add up for positive students versus quarantine students, it can become very confusing. The difficult position that we are in right now is that the options offered to us by DHEC come with some stipulations, and we have spoken to them extensively about this since the guidance came out. I've met with them. I spoke to her late yesterday afternoon. DHEC stresses that although there are options, if you cannot safely and effectively implement a shortened quarantine, they do not recommend it. So at this time, and again, this is not forever, this is not something we want to go on indefinitely, but at this time, we as a district have talked to our principals, our administrators, we don't feel that it is safe or effective to reduce quarantine at this point. Although it would bring students back to school sooner, it comes with the added tracking and tracing and enforcing masks for those who are returning early. It also comes with the added piece that we have to look at for our students who are participating in athletics and extracurricular activities. DHEC has said that if you cannot find a way to ensure that everyone returning from a reduced quarantine is following the rules exactly as they are outlined in the exclusion list, including mandatory masking, that they don't feel it is safe to do it. So based on our current operational status and how hard our staff is working just to get the instruction piece done and the bare bones of the school day, we don't feel that it is a safe time to try to effectively reduce quarantine, but we're keeping an eye on the numbers because it's always our goal to keep students in school longer. So we don't want to keep this going on forever, but right now is not the time that we feel we can safely meet that mark.
Mr. Pye, I asked you this question, I think yesterday during one of our many conversations, but some of the other districts in the area have opted for the 5-day with the understanding that we do not have the staff, nor are we able to ensure or monitor the mask that when they come back.
One district, yes.
So when they come back that other 5 days, they're not able to say, you've got one more day on your mask, so put your mask on, that kind of thing. So because they've opted to do that, and it's kind of on a you know, it's your responsibility type thing. When you come back, you know you have 5 more days of mask wearing. Have we thought about that, doing that?
Absolutely. We talked with him yesterday, how that was going, and he made that very clear, and that is what they're saying, but they're not able to do it. And that's our point, is that is the regulation, and I'm not willfully not going to follow what we're told we must do. And if the staff can't monitor it, that's not fair to the other children, the other half of the world who wants to be safe, that we've got people still running around not producing any evidence that they've been tested, or they're wearing the mask. It's just a lack of protection. Whether we believe it or not, that's the guidance that we have been given. We waited a long time for it, and so typical of agencies, they give you the carrot and then they dangle all the reasons why they don't want you to do it, almost as if we don't want you to do it. So we're gonna make it hard and the hurdles. Charleston is avoiding that, and they're trying to avoid the virtual because they have the mask mandate. They are a large district, and they're doing that, and they feel it's working well for them, that the children and the parents are cooperating, and they do have a list, and they have like 80,000, 55, 65, I forgot what the number is in Charleston. It's a large number of kids, and they have like 1,000 exemptions for various health reasons, maybe a religious reason or something, and that's, other than that, they're enforcing the mask. And I even called the principal there at Wando High School, very large school, and she felt it was working. I went there last year during the mask mandate. I shouldn't be talking about this publicly, but everybody has a different standard of that. You know, in the lunchroom, there's no mask being worn because you can't eat. But remember now, if the kid's not eating, they're in the lunchroom where the masks aren't enforced. And if they're not eating, that's what they're doing. They're talking, and they're in each other's lap practically. I've witnessed that. And that is just defeats the whole purpose. So that's our concern, is we have those times of the day when that is occurring. So why make a child wear a mask when we have these periods that is totally ineffective? And if this lady here, if comments were only half right, and I'm not doubting them, it makes you question. You know, there's so much research saying there's not even affected at all, but that just happens to be the regulation from DHEC. And so that is the rub, is the staffing to do what we've been asked to do, and the questioning from not only the parents, but from all of us, is that really necessary to have that last part? And that was our conversation. So that's where we are with that. So we are a district of excellence, and we worry about anything happening and going south and someone pointing fingers saying, well, your district was irresponsible, you didn't do what you need to do. And like I said, we could fill this room if it were at night. I know we'd have lots that we couldn't do it here. We'd have to have it at the Coliseum. And I'm telling you, it would be a lot of vocal people saying, what you're doing here is still not what we would like to see. We would like to see all these other things. So it's just torn. It's a complicated subject that's very divisive, very questionable, and we're the ones that have to do it. And we're just like all the other humans in the room. We have the same questions. And my personal philosophy may not be the philosophy that I always show as the superintendent, when I have to be fair and across the board.
Well, I just want to add a comment too. I think everyone, especially people that have really done their research, know that DHEC CDCs are certainly listed on their website, and if you talk to them, they all say they're guidelines. However, it is mandated to public school systems from the state of South Carolina that we follow those guidelines. So saying that means that it is a mandate for the public schools
That's
to
the
do
real
what
bottom
CDC,
line. It's a political mandate.
puts down as a guideline. So even though they tell you, well, we're not making the school districts do this. This is just simply our guideline. They're exactly right. But when you get it mandated from the state that you follow those, then guess what? It's no longer a guideline for us, it's what we have to do. So I just wanted to
Thank you
clarify
for
that
that, 'cause
up, but,
I forgot, I should have said that was the number one factor, but I just assumed everybody knew that, and I didn't go there, but thank you for bringing that up.
But I
And
also-
just to add to that, that goes for not only the quarantine, but also the decision to, that vaccinated people don't have to quarantine. That is not our decision. We do not make that decision, just to clarify. I'm sure most people know that, but also just to add that. It's important.
And that's the criteria that Mr. Pye is using to make the decision as far as closing classes and closing schools and closing grades. That's the guidelines that he's using. So, but before we go any further, I want to make sure that we reach out to our board members that are joining us virtually to see if they have any comments or concerns or questions as well. So I see a few of you out there. Mr. Mitchum, I see you. Do you have anything that you'd like to add or comment on?
Thank you, Madam Chair Hughes. Mr. Pye, one thing that I would like to ask is, so this could essentially be a day-to-day decision as far as closing a school or a grade. Are we looking for a daily number? Are we looking for a 2 or 3 day numbers that are trending upward, or it's heading there, or how is the decision going to be made? And is it going to be decided in the afternoon or the evening, or how would we communicate?
Well,
I know how we would communicate.
One day this week, the numbers changed 500 from 9 o'clock to 2 in the evening, 500. Then from 2 in the evening to midnight and 2 in the morning is another couple of hundred. So the numbers are just rolling in as people call and tell us that their convenience, would not know otherwise. We're using the numbers mostly what the nurse and the schools have, but then we get all these call-ins, and the next morning a teacher calls and said, I'm exhibiting symptoms of this and I need to go get checked, so I will not be in school today. That's it, but then we know she may be back tomorrow. It may not be what we think it is, and she is able to return with her test. My answer to that was it can't be daily. We try to make it daily, but probably within 2 days. That is an ongoing issue that we want to know. Once we know it's across that threshold, it's not that we have to do it that minute, but I would like to see a little bit of a trend. I'd hate to close the school because let's say we say 30% and it's 30.1. 2 days later, it drops to 29.4, but everybody's home for 10 days. You see, so we do really have to have, that's a good point. We have to have a pattern, and that's what we were so late in the night trying to decide about the schools. And I learned as of this morning, I thought it was going to be 5 or 6, and it was 1 that we feel has consistently shown it's there. And the numbers are rising, and it's considerably moving above 30. So I think that's probably safe to say. But I think the borderline ones don't have to be a rush to do. I think we probably need to give it a day or 2 or 3 maybe. Because the point is, especially with elementary, we have to give the parents some knowledge because of babysitting. That's a real issue.
Yes, I was going to add to that. You will give parents as much
as
notice
we can
as possible.
Well, see, like today, if we close a school, they will learn as soon as this meeting's over, the next 30 minutes, it'll be out there. And then, of course, they have the rest of the day, Saturday, Sunday, and Monday. And when a lot of places close, it's going to hamper maybe how they operate. That's very short notice, but we feel we need to capture the long weekend. In this case, it's kind of a situation. But if it's going to be, whether we do it on a Monday, Tuesday, or Wednesday, that I think we're going to do what we can to work with the school staff to see how well we can navigate that to where pretty positive.
Well, I think one of the good things is the fact that we have this report that goes out daily that shows the percentage in each school. So, and it's available to the parents on our website. So if they go out there and they look at that, they can watch the numbers and watch the percentages and see if their particular school is rising in percentages. So then they know to then, we're getting close to the 30% mark, so, you know, we may need to go ahead and start looking for something, because there is a big possibility that our school could close. So,
I do think, though, it doesn't state on that dashboard the percentages, so it is difficult. Not everyone necessarily has access to numbers to calculate that.
and
So
maybe that needs to be added to that.
I know that's,
The only fallacy is that it goes opposite of what Mr. Mitchum is saying. It hits 30, we're gonna have everybody's brother calling. It was 30.0 this morning.
Right.
Why is this school not closed?
You're right.
You see what I'm getting at?
yes, but I
And
also
then-
think it's fair for you to have a range, and you should have a
We
little
have a
bit of
range.
flexibility and
Well, I want people to
authority when it
understand,
comes
that's
to
what
making
we're
that
saying. We have to have a little bit of range. It's not that good of a science, and then we've all had the facts thrown to us. You know, the whole number is questionable.
well,
Can I bring up a couple points to maybe tie those two things together?
Yeah, Mr. Farnsworth.
Yes.
Hey, good morning. So I do think in some way or fashion, because if we're putting that quote unquote metric out there, you know, the 30%, we do need to have a way that folks know what that actual percentage is. So I do think that adding that to the dashboard,
So they know
and
it's
more
coming.
specifically,
Mm-hmm.
okay, more specifically, I think we need to be proactive in letting folks know, you know, at an individual class or an individual school as that time is coming.
Okay.
I think as a district and as a school, we need to be proactive, letting that parent population know, hey, this is the metric we're looking at. We are closely monitoring this. And as we get closer to this number, it could become a very real possibility this school will have to go into another model, i.e. virtual, whatever that looks like. And again, just being very proactive, because I think that's when we tell someone the day of, that's when we're going to run into some major issues. So the more proactive we can be, because we can see, again, to Mr. Pott, your point, over a couple days, over a day, 2, 3 days, 4 days, we're going to see that trend of the percentage. And we're able to then proactively communicate that out to those specific grades and classes as well as the school. So I would like to see us do that. But I will just tell you, I think it's a very solid plan. I appreciate you guys putting that together to be able to just look at closing individualized areas versus the entire district. So I very much appreciate that. Thank you.
Could I ask a question that's a little bit back to something we talked about earlier about masks? And I know that CDC requires masks on buses, and I totally understand why, because you're like 12 inches away from the next person. My question was, have the bus drivers or Mr. Shope had any disciplinary problems with the children wearing the mask?
Let's ask Mr. Shope. You've having problems with his kids? I know that they're not wearing them, and we furnish them thousands a day.
Come up to the mic, Mr. Shope, please.
We're going through some masks now. That's a federal, I just want you to know that's a federal
Right.
guideline.
We have no,
and
yes, absolutely.
The answer is yes. It's next to impossible to enforce. The seats are built tall now. Can you hear me? I'm hearing it echo. The seats are built tall. Most of the students are young and behind the seats, so you can't see them. So yeah, they get on the bus, the driver hands them a mask. You know, and it's they come out of the schools. I see videos pretty much every day. They come out of the schools. 10 or 15 kids have to get a mask from the bus driver, and they walk down the aisle and sit down, and maybe they put it on, maybe they don't. And it's a constant battle, and really the bus driver shouldn't be stuck in that position to have to police that, because it just creates conflict. And
they don't have time to do it.
It led to a giant fight on an Ashley Ridge bus. One of the worst ones I've ever seen, because the kids were at each other and the bus driver was in the middle of it. And so it's just that's one I'd prefer to see go away, because it's more trouble than it's worth, and it's costing us gazillions in masks.
That was our whole point. That's the same thing with the schools, enforcing it, no matter who believes what. We don't have the ability to really enforce it. And what do you do with the kindergarten child, 5, 6-year-old child that's not wearing the mask? We are going to send the child home? I mean, think about that. Who's the problem here? Maybe the parent. Now, the child could be absent-minded and very immature. There could be issues like that, and you work with kids like that. But it could be a situation where my mama said not to wear the mask. So, but the child is 5 years old, and they're doing what they're told to do, and we're not gonna collide with mama over it. I mean, that's just not our business. We're not the parent. That's unfortunate. We're not seeing it the same way, but those things are happening, and that's part of where the principals are coming from. It's not just the staffing. It's a lot of follow-through. It's a lot of monitoring. And we're monitoring, and if we've got a breakdown, then we've put everybody, if this is the case, everybody's at risk, and we didn't achieve a thing except wear people out more and make issue and make everybody mad, and end of the day, it's not working for us. Now, like I said, Charleston said they have very few issues anywhere where the people are wearing the mask and things are fine. Quote,
It's
and
a
I'm
well,
quoting.
my-
distraction on the bus.
My
as well,
question,
safety.
and you're hearing it, I mean, I heard it yesterday on national TV, and I'm really asking because I don't understand. A lot of people are saying the kind of masks that we're giving them are really not beneficial.
That's what I'm saying.
Is this, I mean, are we wasting our money? Or is it helping in some ways? And I know
When
could
we,
prob-
when we bought these masks, we were told it was the best thing since
Right.
ice cream. We had some controversy. It's just as of recent, it's coming more and more. If you can find the mask, we tried to buy the nice masks, whatever they're called, in something. Right,
yeah.
those, and they were halfway reasonable. They've gone up in price, or they could have gone down. The problem is you can't find them, not in the quantities we would want as a district.
and they are expensive, the
There, it
N95.
is, at the end of the day, when you're buying 27,000 of them and you have to replace 2,000 a day, that gets very expensive.
Yeah. Yep. Okay, thank you, Mr. Sho.
Can I say one
Oh,
more
I'm
thing?
sorry,
Can
Ashley.
we go back to, just going back to that threshold and how we're gonna notify families? So I do think it would be very helpful to have that on the dashboard, the percentage, so people can monitor it themselves. But I
problem with it.
also think that it would be helpful if we could do some sort of messaging as we're approaching a certain level. That way, people would have an idea that it could be coming. I have heard of other districts sending out just a message to families saying, you know, that the potential for it to
Right.
happen
We heard it
is
at a board
possi-
meeting with
Right.
Greenville County.
Yes,
did this.
exactly. So just to give them as much notice as possible, a heads up that we are approaching it, and to just have it in the back of your mind.
Yes, ma'am. And Ms. Benet has got my attention, the audience. She has volunteered to get the numbers from all the sources we use, and she will get that school-wide number that we have, and so we can keep reporting it often about what's happening. And so people have an idea where we're headed and where we're not headed. Now, you'll see it could be 30 today. That's what we hesitant to say on one day's notice, because tomorrow it could be 28. It could go from 30 to 40, and somebody calls and says, my goodness, this is horrible. Why haven't you done something before now? So we've got to agree that there's two sides of this, that we can't just throw children out with no supervision in their homes. We have to work with the public if we expect them to work with us. So that is just the right thing to do.
Okay, we have one more board member online, and that is Mr. Evan Guthrie. Evan, do you have anything that you would like to add?
No questions at this time, but yeah, I just want to say thank you for everybody staying on top of this and your tireless efforts to make sure that we're protected and safe. Thank you.
Thank you, Evan. And I do have a comment that Ms. Crosby asked me to please read in her absence. I am going to read it exactly as she sent it to me. So her comment is, again, this virus is not going away in a week or a month or a year. It has reached its peak, so should get better. I think parents will mutiny if we close more than a day. So maybe just Monday and Tuesday only. That will be 4 days. They don't have childcare and they have to work. We heard that over and over last time. I imagine that some have already had to miss work if their child was quarantined. Even on the news tonight, they said, Biden wants kids left in schools. I hope we can just hang in there and ride this variant out. We know there will be more variants coming out, and we can't keep pulling kids out of school over and over again. The day could be made up later as a bad weather day. So that was her comment, and I wanted to make sure that, that I read that so that she was able to voice her concerns as well. So does anybody else have any other comments or questions?
I just appreciate what y'all have done since Monday night, and I know it's your decisions, and the board is listening and wants very much just to support what you all have decided to do. And I think it's fair, and I think it's logical, and I'm glad that at this point, we aren't shutting down all of our schools. Thank you very much. And I appreciate what the principals that were here, what they had to say. It was very heartfelt, and I knew nobody was prodding them. They were saying exactly what
I
their
had
team-
no conversation with these three principals at all.
Thank you,
None.
that's all I have to say.
I wanted to, but there was no time.
Yep.
I just have one other question. So when a school is in virtual, will we continue meal services like we have in the past?
Absolutely. And matter of fact, if the whole district were to shut down, like we've done in the past, we only served a couple of sites, but since I pay the bus drivers to work, I would then want food taken to each route would have maybe a pickup place. So instead of having one school do something, I think we owe the public, it's free, we don't pay for these meals. I'm paying for somebody to drive the bus. And people who are doing virtual school, there's not a minute free to drive, and many of them don't have transportation to get up here to get the free meal. So we're going to have to take the meal to them. I've already decided. I was not happy with that before. I was overruled by whomever and whatever, but Sodexo has a contract with us, and they're going to do what I want them to do.
I want to ask a question about extracurricular activities. Will they be continuing as normal, or will there be any changes to that?
They will continue unless it's that school is closed. If we close Seville High School, all their activities cease for that period of time.
But the only time there will be a change is if the school is actually closed.
That's correct.
Okay.
Or the district,
A lot of questions have come across.
not the
on that.
individual district. Well, again, we're trying to keep things running halfway normal,
Possible, yep, yep.
much as possible.
Okay. Okay, anything else, anybody? Mr. Pye, is that everything? that
Other
you have?
than, I guess I need your blessing that it's okay for me to do this.
It's not something that we have to vote on, so I think this was for an information purposes only meeting, so, and I think you have our trust and our
You know how I
confidence,
am.
and-
You will be called. At least I've asked you to do what you need to do, that this is what it's looking like. And thank you, Mr. Mitchum and others who brought up the point. If we are watching it, you kind of know, and you might be calling me. I'm sure the principal will be calling, some parents may be calling on both sides of the issue. And therefore, we would make a decision, but giving enough notice for people to get their act together and help us.
Mr. Pye, Ms. Hughes, I apologize, just very quickly. Can you also ensure, I'm sure that'll go out, obviously, to the parents of the affected school grade and that sort of thing. Can you also make sure, of course, that the board is let know of any schools that you're looking to close potentially?
Absolutely. And the only reason I'm not announcing that today, because we didn't know we could or would right now in this room, is because I think it's wrong for some of our population to know this, and parents at work and they're getting this call that their school's closed. I want them to hear that explanation from the school district and from their principal. Both.
Absolutely. Thank you.
They'll get multiple messages. It'll be on the web, and you'll know immediately as soon as we're ready to pull that button. You'll be the first person to hear it.
Okay. Okay, well, then I guess if we have no more business for the good of the district, then I will need a motion to adjourn this meeting.
Motion to adjourn. Evan.
Motion by Mr. Farnsworth, or Evan Guthrie, I'm sorry, and seconded by Ms. Robinson. Any further discussion? All in favor?
Aye.
Aye.
Mr. Farnsworth, that was six and one absent. Thank y'all very much for attending, and we look forward to things getting better on the uprise. Thank you.